set. Welcome, everybody. This is the Board of Health and the City of Gardner meeting, monthly meeting, and it is January 27th at 4:30 p.m. Meeting is called to order, and first item is the review of the minutes from December 9th, 2024.
Make a motion to approve.
Any discussion? The only thing and A and D should be an A and I don't think that's we want to.
Which paragraph?
Sheesh.
We'll just
Packet.
All right. All in favor to approve the meetings?
Aye.
Aye. And myself, aye. Meetings are accepted. Do you want me to sign mine?
Yes.
Did everyone who's visiting sign in the sign-in sheet? Okay. So next item on the agenda is tobacco violation hearing, James Friskowskis, Anthony's Package Store. Before we begin, I want to explain to you why the hearing is taking place. The violation did occur in October, I think it was October 20th. And it came to my attention December 3rd or 4th, I can't remember, I think December 3rd, that what I understood was that Mr. Kriskowskis was aware of the violation, but he had to travel out of state for a family medical issue shortly after, and kind of just was back, put it aside, and came back, and the 3-day suspension was to happen. And so normally if there's a violation, you have within 7 days to appeal the violation, and it was out of compliance based on I felt extenuating circumstances. Having compassion for that, I granted the hearing. After, it was kind of like in between messaging between Micah, Joan Hamlet from the Tobacco Alliance, and myself. We granted the hearing, and then we gathered more information which will be presented, but found out that the fine actually had already been paid, and so the fine we can't do anything about. The only thing that we're going to continue with the hearing, and we're here for it, but the only thing that is in what we have any jurisdiction over doing anything about at this point is the suspension of the sales of tobacco. So that's why the hearing is happening. So I'm going to ask Joan Hamlet from the Tobacco Alliance to present the information and the facts of what led us here today.
Okay, so just for the record, I'm Joan Hamlet. I'm the director of the Board of Health Tobacco Control Alliance, and I am also a Gardner tobacco agent. And this is Rick Sidelli, who came with us, who is a Gardner tobacco agent, and he conducted the inspection. So on October 20th, we went in and conducted the annual youth access inspection, by which we inspected everybody on the same day. All 17 retailers were inspected all on the same day. It resulted in 3 sales to minors, and one of them was Anthony's Liquor. So approximately 11:04 a.m., our 18-year-old youth inspector went in and was able to purchase from an older adult male, was the description that the youth gave, backwoods cigars for $9.78, and they failed to ask for an ID or verify age, and it resulted in the first sale in a 36-month period for Anthony's. And we went back in the state database record, and there is, he asked us to go back to 2019. We usually go back to we go back 36 months. However, I went back to, I think it was 2009, and there's no record of a sale any other violations, state violations with Anthony. So this was properly issued under the state law. This is a template that we use that was given to us by the state to use for when there's a sale to a minor or a flavor violation or any of the other state mandates, and it calls for a $1,000 fine and a 3-day business suspension, and we attach that in a separate order. So that happened on October 20th. On November 4th, the violation order went out to the retailer. On November 14th, the city of Leominster received a check from Anthony's signed by James Krasowskis. So it was paid for on November 14th. On our Alliance end, on December 4th, Wednesday, December 4th, staff gave a courtesy reminder call to Anthony's, and we call the store number and we just ask to speak to owner manager, whoever's present, and we just give them a courtesy reminder that their suspension started on Friday, how to cover their products, what they were supposed to do, asked if they had any questions, and let them know that the inspector would be there Friday morning and that secret shoppers come in on the weekend. In the meantime, on December 6th, Friday morning, my inspector went there and cigarettes and everything was still out, and they let my inspector know that there was an appeal pending, and then that's when I told her that's fine, just exit the store, we'll call the city and figure it out. And that's when the phone calls happened between Micah and us, and we found out that the day before or a couple days before that he had requested a hearing. But the violation was received and paid for. We know that it was paid for on the 14th, so we, obviously it got lifted. Sue made the decision, not realizing that the violation had been paid for, to allow the suspension, but the state law does allow for any retailer to appeal the whole violation or in part. So they can appeal just the fine, or they can just appeal just the suspension, or they can appeal the whole order. Upon payment of this, responsibility was taken for it, so this hearing is about what to do about the suspension. We issue 3, all 46 towns issue 3, 7, and 30. 7 is required for the second, no less than 7 for the second violation, and no less than 30 for the third violation. For the first violation, the state law allows 1 to 7 days. So for a responsible violation, the board can't issue any less than 1 and no more than 7. And it is 3. So here, the decision that the board, after hearing testimony, would be to, they could reduce it or increase it or leave it the same.
Can I just ask a question on, we were looking at the CMR on this, and I see in the violations section saying in the case of a first violation, a fine of $1,000 shall be imposed. Where is the suspension?
Right above it.
Yeah, right above it, it says 1 to 7 days. Because for a flavor violation, there is no, like other violations such as flavor, couponing, it's only a $1,000 fine, but for sales to minors, it has to be 1 to 7 for the first violation.
Jeff, I think you were looking at that's the MGL, that
Oh, okay.
first one you're looking at, and then
Yeah.
that one was CMR.
Because that was,
Well, no, this is the CMR, but I think I might have, this didn't print the whole page, it might have cut off.
Yeah, it's in a separate paragraph.
Okay.
There's a paragraph for the whole law, and then a paragraph specific to the sales to minors.
Okay. Right.
We go in with a iPad, and we open up and enter, as soon as we pull into the parking lot, we open up the inspection for the retailer, and the iPad satellite tracks, stamps it with satellite time, and they stamp the coordinates of where we are for proof that we were in the store at that time. And then when the youth comes out, we enter everything, follow the protocol, and enter everything into the state database, and it uploads into the state database. Reasons for not responsible would be the board feels that evidence doesn't support that it happened. It would be, we made a protocol error, a procedural error. However, that doesn't come into play because the retailer paid for the violation and took responsibility for it. Those would be the reasons that we would put in. And then in terms of the violation, fine, for a responsible finding, a board can't reduce the fine, but they can increase it if they have that in their local reg. So our recommendation would be Our recommendation is this was a solid violation. There's no protocol errors, there's no procedural errors. It's an unfortunate, expensive mistake. But every retailer since January 1st, 2020, who has sold to a minor has received the 3-day suspension. And we had 2 other retailers that violated and paid and served those suspensions from this particular violation.
Mr. Kraskowskis, would you like to speak?
Thank you.
Just state your name and
Sure.
city.
Okay, my name is Jim Kraskowskis, James Kraskowskis. I am the president and the primary shareholder of Anthony's Package Store, Inc. at 12 Pearson Boulevard in Gardner. I reside at 4 Rice Lane in Princeton, Massachusetts. What is the goal of why we're here? The goal is to reduce the use of tobacco by young people in Massachusetts. The complaint being discussed here is that on October 20th, 2024, I, as an employee of Anthony's Liquor Mart, sold a pack of 4 small cigars for $9.78 to a youth inspector. The purchaser was, in fact, an 18-year-old adult. A person under the legal age to purchase tobacco in Massachusetts, but in fact, an adult. For this offense, Anthony's is being fined $1,000 and forced to surrender its tobacco license for 3 business days. This particular act that this violation comes under is an act of modernized tobacco control in 105 CMR 665000. And I just want to give you each, because I don't have enough for all of you, but you can just see, this is what I sold. So I want this to be clear. This is what I sold to an adult. Okay? Now, I want to bring your attention to 105 CMR 665.045 violations. The last sentence of paragraph A reads, such fines and actions related to any violation within a retail establishment shall apply against the retailer and or his or her business agent and not an employee thereof. What the legislature wanted to accomplish here is to only punish the retailer owner and have no liability for the clerk who made the sale. It's very noble. But what happens in reality? Not long ago, I was at my doctor's office for a physical, and I explained my circumstance to a nurse's aide. She told me that her girlfriend, worked for a...
Excuse me. I forgot to ask if anyone was recording. Are you recording?
No.
Okay.
Did you have a chance to sign in to?
I wasn't asked.
I know, we
I wasn't asked
can
yet.
right after.
Sorry. Continue, please.
that her friend sold tobacco to one of your decoys during a different compliance check. Her friend didn't get fined, and her friend didn't get charged. Her friend got fired. We are living in a society where most people live paycheck to paycheck. I don't think that's the case in this room. If she was making the minimum wage of $15 an hour, she was making $600 a week. After your letter arrived, she was making nothing. Assuming this woman goes to the unemployment office to get unemployment benefits, they will be denied because she was fired for cause.
Excuse me, but that really doesn't
It
have
does.
any...
All of this is relevant, if you please let me finish.
I'll give you a few more minutes on
Well,
it.
I have a lot here, and I've done a lot of work on this.
Okay, this hearing is only
I understand.
regarding, if you want to have, more information and do a hearing on the tobacco regs itself, and how they-
Am I going to have a chance to present?
you're gonna have a chance to present, but we can't do anything about it's only on the violation that you have. If there's, you wanna look at all of the tobacco regs itself, and, you can request a hearing that we discuss that and
Well, I
open
mean,
that up.
Agenda
I
item.
requested a hearing. This was a
This
hearing.
is a hearing, but on your violation.
This is a hearing on my violation.
Well, just to be clear, we're talking about a state regulation passed by the legislature,
Right.
not this board.
Right,
And we have some latitude in enforcement of the suspension period, and that's
and
it,
that's
right?
it, not on the.
We don't set the minor age, we do not set the penalty, and we do not, if a business chooses to fire an employee, that has nothing to do with the
Right.
Board of Health, or that's a company policy, it has nothing to do with us.
I mean, I think I know what you're leading up to,
Yeah.
and I don't disagree with you politically on this. I think that, personally, that the fine for the first violation, I mean, if you look at the local regulations we passed back in, what was it, 2017?
2017.
Ours were less stringent than that, and I think provided for a first violation without a suspension, but just a fine. So, again, I don't want to get too deep into the political part of it, because I don't think necessarily, I mean, for myself, I can speak that I don't necessarily disagree with the point you're trying to get to, but we certainly want you to have an opportunity to be heard as well.
And that's where, I mean, if you want to, really look in deeper about the regulations in itself, I mean, because in essence, the violation occurred, you paid the fine, you had 7 days to request for a hearing, and like I said, I did grant the hearing despite that under what I thought was extenuating circumstances, not knowing you'd already acknowledged and paid the fine. So again, with what Jeff says, I mean, we have to just be specific on your violation with regards to why we should repeal the suspension.
But we can't repeal it.
And we can't repeal it, but decrease it.
I'm sorry, Joan, before you, we're going to let you finish,
Yeah.
but you said there hasn't been a violation since what year?
You went back.
I think I went back to 2009.
2009.
There was no state violation since 2009. We had a few things in there about local unlocked cigar humidor that we handled locally, but there's no state violation, no DOR violation, no FDA violation, no
Okay.
state violation, no DOR violation, so.
So just with that in mind, we want you to be able to
Yeah.
finish.
So then I will skip that part. I respectfully appeal to the members of the Board of Health to rescind the complaint against Anthony's Package Store Inc. for these reasons. The compliance check was entrapment. The compliance check, fines, suspension are in contradictions to the guidelines of the legal handbook of the Massachusetts Boards of Health. Third edition, Chapter 12, page 113, paragraph 1. The compliance check and suspension is a violation of the rights of Anthony's Package Store under the Massachusetts Constitution, Article 26 of the Declaration of Rights. No magistrate or court of law shall demand excessive bail or sureties or impose excessive fines. The compliance fine is in violation of the rights of Anthony's Package Store under the 8th Amendment of the United States Bill of Rights. Excessive bail shall not be nor required, nor excessive fines imposed, nor cruel or an unusual punishment inflicted. And lastly, the compliance check and subsequent fines are selective enforcement. My purpose today is to defend Anthony's Package Store Inc. That the compliance check was entrapment done in an unethical, purposeful manner outside the norm of the guidelines of the Lemonster Tobacco Alliance. The compliance check was done in such a way as to settle a grudge with myself. The only offense to which Anthony is being fined $1,000 and lost his license for the sale of one pack of cigars for $9.78 to an adult under 21. It cannot be deduced from this transaction that this is the normal conduct of the management or employees of Anthony's Liquor Mart. The complaint is for a one-time event. I had no motivation or intent to sell a $9.78 package of cigars to an underage person. I made a mistake, an indiscretion, yet I'm being fined in gross disproportion to the severity of the event. In the Wednesday, January 22nd, 2025 edition of the Gardner News, Ms. Hamlet makes several remarks that I found rather disrespectful. Regarding my appeal, she says, I have been doing this for 30 years and I have never seen a business pay the fine and then after the fact ask for their money back. I'm very disappointed with this remark because she knows how this appeal came about. When my store received a letter from the Leominster Tobacco Alliance, I was at the Mayo Clinic in Jacksonville, Florida. I am there twice a year for medical reasons which are confidential. The employee who read the letter to me from the Tobacco Alliance only told me what the fine penalty were. He failed to inform me that there was an appeal process. When I returned from the Mayo Clinic, I was past the 7-day appeal period. I paid my fine and prepared to close tobacco sales as instructed. On Thanksgiving Eve, I happened to meet our mayor, Michael Nicholson. When I explained to the mayor how disappointed I was with the city's over-the-top fine for such a small indiscretion, he intervened on his own without my asking. I did not ask him to intervene, to allow me to have an appeal. The mayor was never informed that the action of October 20th, 2024 was going to occur or had occurred. He had no knowledge of it. The Leominster Tobacco Alliance did not have the courtesy to inform the elected chief executive of the city of what it was going to do or what he did. The mayor even said that he didn't even know Rick Soberli, sorry if I butchered your name, Rick, the Gardner tobacco agent listed on the complaint. I am 78 years old, Ms. Hammond, and in my opinion, I have been in the retail liquor industry a lot longer than you've been doing what you ever do. You are further quoted as saying, there is no viable reason for retailers to sell to minors, and that's why the fines are so high and the laws are pretty strict. And I like this. We want to help people into compliance. We are not here to catch people in the act. These are just really expensive mistakes. And yet you just heard that you go back all the way to 2009, and I've never been out of compliance. So how is this helping me into compliance? Ms. Hamlet obviously has never worked in a retail business. We work hard. The hours are long, and the work can be very taxing. In the current economy, it is very difficult to get qualified help. In my situation, from May 3rd until October 20th, a span of 169 days, over half a year, I had 17 days off. That is what it takes day to day to keep a viable retail business running. It is hard. Because Ms. Hamlet does not work as hard as we do, of course she has no clue
No,
why we are
excuse
talking.
me, there's no reason to
Well,
be attacking Ms. Hamlet and.
I'm just reporting to what she says.
So, I think that, again, I want to stress that, you know, there's a point of reference about the city and everything, and that we're talking about a state law here passed by the state legislature. You know, so, again, I think maybe it's, I respect your comments, and I believe that you have a point with some of the things you're saying. I do want to stress that Joan is doing her job to the best of her ability, and that we do take these violations seriously in the protection of the public health. I want to make a motion and open it up to discussion that, you know, being that this is a reputable local business, there's a spotless record here for 15 years, I would make a motion to reduce it to 1 day. And again, I'm not speaking for the board, but I'm putting it out there so we can discuss, maybe with reference to the specifics of the violation, you know, what should be done here.
We have to close the hearing first before we have discussion, correct?
No?
No?
So I was just asking if there any additional presentation?
Yeah, there is,
to be
yeah,
made.
quite. It's about 60 hours on this.
I
Well-
understand, but we have to limit the, you know, the things that we have no control over, and we have to limit the attacks on people doing their job and then in the public health too. So if there's something specific that you need to close with, I invite you to just get that last part.
And I will correct the fact that the mayor did not intervene in the sense of he did not request, he's not going to know all the employees or people. he asked me, told me about your extenuating circumstances, asked me what can we do since the time frame was already passed for the request for appeal. And again, I granted the appeal and the hearing based on the extenuating circumstances presented as on a compassionate level with that. So we do care about the retailers. Unfortunately, the laws are state laws, and they are very specific with underage sales. And, 18 is considered an adult, yes, but the laws for the sale of tobacco to underage is 21. And the whole process is outlined in the regulations with the education that's received every year, each retailer, on the fact that there will be compliance checks and people will be coming in throughout the year. So this is all there, and I believe every year all retailers are educated in that. The other retailers who had violations also, we have to, I think, I will say, be careful too and not setting precedent on reversing decisions that were made after the fact, because that day there were 2 other retailers and they did not request hearings. We do have the hearing, but it was, after the fact, so just to keep that.
Yeah, I mean, I'm just saying, my opinion is that if you go 15 years of sales without a single violation, there's an obvious good faith effort here to comply with the law. I mean, there's no repeated course of conduct, and I don't know. I think that, again, it's the regulation is what it is. Our regulations that we discussed and passed in accordance with what we thought was fair were much less stringent than what the state regulation
And
is. So,
Yeah, we just can't change that.
Right.
Is there a
well, I'm
specific-
saying, I'm not saying we're changing anything. We don't have any discretion to change a state law.
You do have the discretion to go down or up.
That's right, yeah, that's all
Is there
I'm
a
saying.
specific period of time that the 3-day suspension was supposed to be held, and that was?
All
what we were
suspensions
giving
start on a
compassion?
Friday. Yeah, all suspensions start on a Friday, whether they're 3 or 7. 30 days always start on the first of the month. So it was supposed to be December 6th through the 8th, Friday, Saturday, Sunday, and they could resume sales on Monday. A 1-day suspension, we would reset the date here if that's what the board ends up voting on. Whatever you end up voting on, we would reset the suspension dates here. You did allude to this, Sue, so I just wanted to, this is a document that everybody has and has received, and for the record, I just wanted to say, these are the FYI education packets. We usually have full packets, but I only brought the annual FY memo for each year, and I have 5 years of signatures. 4 of them are from James, and the one is from their manager for the FY24. But we highlight, they sign that they receive it, because in addition to a youth access compliance check, we do a youth retail education visit where we give them the education packet. We go over everything in the packet every year, ask if they have any questions. We offer additional retailer ed where we can come in and educate employees on site in the store if that's something they need. We offer materials if they have any language equity issues. We do this prior to doing these inspections, and as you can see, we highlighted in yellow on each year's letter where we specifically talk about, please be advised, the youth sales to minors as per state law is 1,000 to 5,000 in suspensions that boards cannot reduce. So we provided that education since 2020 every year, and we provided all the signatures. For Anthony's, he has a copy as well, because we do work hard to help people come into compliance and not catch them in non-compliance by all of our educational efforts. And, all of the local inspectors in tobacco control, MTCP funded, we are trained the same FDA inspectors, local inspectors and state inspectors all follow the same state training and protocols. So all the youth inspections done by the federal, us, and state are all following the same protocols. The difference is, as your local inspector, any fines collected go into your general fund, whereas, you know, state inspections, they don't go into your, you don't get the money. Our goal is to help people come into compliance, it's not to catch people in non-compliance. But unfortunately, regulatory checks are part of the process of holding a Department of Revenue license and holding a local tobacco license. And the governor declared youth access to sales to minors and vaping a state of emergency in 2019. Our current governor has left that state of emergency in place, and our 3 attorney generals since that time have also declared youth sales to minors. Selling to a minor is one of the most egregious violations of the state tobacco law. And in context to the newspaper article, I said the governor imposed the fines and increased them from 100 to 300 to 1,000 to 5,000 because the law does not feel, after all of 25 years of education, now it's 30, but 25 years of education, that there is any viable excuse for a sale to minors. So it was in context to the intentions of why the governor declared a state of emergency. It was not in reference to any retailer. But, you know, again, it was taken slightly out of context.
Thank you for that clarification.
So there's did you have anything else?
Well, you know, you're obviously not gonna let me make my entire presentation, so I just, as I said, I just want to touch on a few points now, since I'm gonna have to consolidate all of the work that I've done over the last 2 weeks getting ready for today. But as I said in the very beginning, that I do feel that this was entrapment. And one of the reasons, for those of you here who haven't seen the tobacco compliance check, I don't know, have you seen this?
Mm-hmm.
You've all seen it, okay?
Yeah.
Anybody else? I'll pass this out. I want you to know that this is a pre-printed form for compliance checks. And you'll notice in the upper right-hand corner, it says survey of participants. In the pre-printed form, there are 2 boxes to check for age. One is 16, one is 17. We expect people to come in and do compliance checks who are easily identifiable as minors. Here, you've written in 18. So you've gone outside of your protocol and used a person who is an adult. Albeit a person under 21, it is an adult. So you, in your argument, could say that you could use a person who is 20 years, 51 weeks, 6 days, and 23 hours old, and that would be an adequate reason, if I sold that person a $9 pack of cigars, to fine me $1,000 and take away my cigarette license for 3 days. Because what's the difference if they're that age or they're 18?
Were those
They're
forms
still an
printed
adult
before
when
the
they're
age went
21.
up?
I'm sorry?
Or were those forms
Yes.
printed before the
Yes.
age went
But
up? to
I
18?
believe the regulations, correct me if I'm wrong, that when you identify someone as being underage for selling, under 21, that you should be, that the regulations mean that you request identification for anyone looking under 27
No.
years of age.
No,
Is that
35.
not?
The state law says you have to card everybody and verify the age of every person purchasing
Okay.
tobacco. That was what was prior to 2020, but in the new law, it means me, it means you, it means anybody in this room would have to be carded according to state law. I just want to make reference.
I'm sorry, I thought I had the floor. I thought that I was
well,
speaking.
We opened up the conversation about
The age
this.
and the form.
So I can do it after and you can
No, it's
finish, or I
fine.
can just clarify this form. What happens is we're out on the iPads and they're Wi-Fi dependent on Verizon Wi-Fi. And often, especially when I'm by the Cumberland Farms, there's 3 spots in Gardner where it dips down. So what I have my inspectors do is use the old paper form from, this was probably 2018, the last time we used this form. And back then it was 18. So I have them, they data enter everything in the database, and as you can see, this is the post database form that everybody received. This is what gets data entered in real time, and that's what everybody received. But I always have my staff take 9 seconds and fill out the old paper form, because if something happened with the Wi-Fi and a sale didn't get uploaded right, we wanted to make sure we had the paper backup to data enter it in. But because this is a form that is done in the process, we provide this form to our retailers. But this is just a secondary backup form in case that there's post-data entry Wi-Fi problems and it didn't get put in that data entry. And if you're going to data enter something in because it didn't upload in real time, you have to go into the state database and get permission to do that and justify why it wasn't done in real time. And that's why we do a paper backup form. And then if we're using, we can use up to 20-and-a-half-year-olds. If we're using somebody, they just write in the age if it's not 16 or 17. So I just wanted to clarify that this is just provided because it's part of the process.
So just going back, I want to make a couple more points about the entrapment. And, you know, the comment that was made in the paper, we want to help people into compliance, we're not here to catch people in the act. These are just really expensive mistakes, you bet they are. And so, as I have not had a recorded violation since 2009, I find it very interesting when I received the record of the number of the accounts of your alliance doing compliance checks in my store, that you did 2 on October 1st, 2023. Now, if I have no record of non-compliance, if I have a record of non-compliance that goes back to 2009, and you come in on October 1st, and I pass your compliance check, the fact that you came back a second time the same day, to me is clear that you were headhunting for me. Now, I know you're not going to let me get into the reasons why that happened, but there was a contentious circumstance with your association, your alliance, when you very first started, and one of your agents wanted to come behind my counter and had no identification, and I wouldn't allow her to. And she called the police, and the police told her that she couldn't come behind the counter. And I had to come to a hearing, and the hearing was contentious. It was so contentious that the woman kept interrupting me. And after the meeting, the mayor of Gardner, Mark Hawk at the time, made identification badges for your alliance. But Dr. Miller, Don Miller, who's now deceased, came to me and said that he was resigning from this board because he never wanted to be involved with such a contentious hearing again. It was very disappointing. So I think that using a person 18 years of age, coming in twice on the same day, and the last thing, you did this compliance check on my store at 11:09 in the morning. We opened the store at 11 o'clock. When we open the store at 11 o'clock on Sunday, it is our most vulnerable time. We have to turn on the lights, we have to turn on the music, we have to turn on the cash registers, we have to turn on the lottery machine, credit card machines, and we have a rush. And we did have a rush this morning when this gentleman came in. And he was over 6 feet tall, and he was 18 years old. In the middle of it, he reached across over my cash register and said, "Can you give me one of those tobaccos?" Now, I have people here wanting to be waited on. I have people that I'm watching for shoplifting. I looked at him, I assessed that he looked old enough to me, and I sold him that $9 pack of tobacco. So, Ms. Hamlet, as you say, you've had 30 years in the business. You know when we are the most vulnerable, and you got me when I was the most vulnerable. So I'm not going to wait, you're not going to let me go through all the constitutional aspects of it because you're saying it's a state law. I feel that when this law was written, that the legislature was manipulated to write it in such a way is that it does not read a fine up to $1,000. Because that would be more fair, that would give you more latitude to say, well, we don't have to charge a fine here. And I've read how this law was crafted, and I never saw how the Convenience Store Association or the Massachusetts Package Store Association had any involvement with the crafting of this law. So this law was crafted as such that like you say, you wanted this. Your association, your affiliation, wanted to have no latitude. that for the simplest indiscretion, the least indiscretion, which in a court of law is defensible, if I am a person of good character, which I am, is defensible if I made a mistake, is defensible if it is unmotivated, which it was. My store grosses $3.5 million a year. I don't need this. I was not motivated to sell this. I had no reason to do this. It was a mistake. And if this was a court of law in front of a judge, I would be found not guilty.
So this is
So,
appealable?
in conclusion, I'm just going to say this.
Is this appealable if he wants to appeal it beyond this, or?
After here, I mean, he could get an attorney and get an injunction at Superior Court and sue. But that's the avenue of that.
Which is, that's a very good point, because as this law is crafted, it is so anti-business. Because in order for me to do that now, I would have to engage an attorney at a cost of between $15,000 and $25,000.
I do want to say.
Okay, so let me finish,
Right.
okay? So this law is crafted, this was crafted by your association, that we're trapped. You know, it came upon us, we didn't see it, I never had a chance, none of my colleagues had a chance to even appear at a hearing about this law. It got stuck on us, and now you guys sit here and say, oh, well, we can't do this and we can't do that. You can do a lot of things if you want to do it. And so I'm going to suggest, and I really thought the mayor was going to be here today, and I'm disappointed he's not, but my suggestion is going to be to the city of Gardner that it disassociate itself from the Leominster Tobacco Alliance. I do not like Leominster telling Gardner what to do.
All right.
I want to just finish.
No.
I'm just saying what I'm going to suggest. And I'm going to suggest that the city council and the mayor pass a rule that when compliance checks are done in Gardner, they have to be done by somebody who's not an adult, and that the purchase is a minimum of $100. Because if this person came to me and wanted to purchase a carton of Marlboros for $149, and I sold it to him, you got a constitutional case. But to say to me that I owe you $1,000 and a 3-day suspension for this is unconstitutional, it's unethical, it's disturbing, it's disgusting. That's my point.
Okay, at this point, anything else for any of us, because I'm going to close the hearing.
I just wanted to clarify for the record that on 10/1/23, 10/1/23, where he's talking about how we went in twice, we did not go in twice. Often alcohol stores, sometimes these inspections are done on the weekend. So what would have happened is, more than likely, because and Rick can attest to this, that lots of times we go to liquor stores and they open later. A lot of stores are open 8, he's out with a kid. You would put in the state database, can you do this store? No, closed at the time. They finish the town and then they loop back and see if it's open before they leave. So it wasn't 2 youth going in there twice, it was 1 in there saying closed at the time and then they loop back at the end of the inspection. That's very common with liquor stores. And I'm not sure what day this was, I'm not sure what hours it was. And once in a while, the state database, because of the Wi-Fi, it loads up, and then you might hit the resend and it sends it twice, and it's a duplicate of the exact same. But never in the history of the Alliance since 1994 have we ever gone into a retailer stores twice in the same day at a youth inspection. It has never happened.
And that's not the violation date?
No, there was no sale that day. So, yeah, this was 2 years ago, not related to today, but I just wanted to clarify because I just think that for the record, it needs to be known that the Alliance has never gone in a store 2 times in the same day.
Do either of you have any other questions?
I just want to say that the law is in place for a reason, to protect the youth, and as a physician, I think the degree of severity of this fine and the length of the suspension is beyond our decision-making. If there's a pathway to pursue that for the mayor or for the citizens, then that's the way to go. But as a Board of Health, we do inspections of food places so that you can comfortably walk in and know that you're not going to get sick. And it's done the same way with like random compliance checks and notifications and re-inspections. And it is a lot of work for our Board of Health to make sure that the community is safe. And the tobacco law is the same way at protecting our youth. And so I'm a little discouraged to hear that you do not feel that that was something that you did admit it was a mistake, but you're not really taking the responsibility that there's a need to card everyone if that's the way the law reads, and if the fines are what the law reads as well.
So you're saying that if you came into my store, I should card you?
Yeah, if that's how the law reads. I know it takes extra time, I know it's hassle, but it's there for a reason to protect the youth. And I hear what you're saying, but until that law changes, we have to uphold those
So
standards.
explain to me on Christmas Eve, when I'm running 4 cash registers and I have 4 lines, 4 people deep, and I'm waiting on 1 person every minute, how do I card every
Have
person?
your IDs out and ready, people, you know.
And I'm seeing the same people, the same customers who've been coming in my store for, you know, my store now is in its 90th year. I've been running it since 1996. So I see people who come in week after week, and I have to card them every time they come in.
That is up to you, because
No, but I'm just saying, that's the law.
That's the way the
That's the law.
reads. Yeah.
You know, and you can look at this. This is an example of the Alcohol Beverage Commission. Now, here's a case where the Alcohol Beverage Commission waited outside of a package store on Cape Cod.
That,
And this person,
Yeah.
excuse me,
yeah, it's
let me
not,
finish, let me
no,
finish.
excuse me,
This
it's
is
Alcohol
relevant.
Beverage
This is
Commission,
relevant.
it's not, because we're talking about tobacco. So right now, the
No, but
hearing-
you're talking about tobacco, and I understand that. And I'm saying this, that in this particular case that I'm showing you, the violation that this person committed, this was an 18-year-old boy who bought a 12-pack of Simply Spiked lemonade, okay? If he drank those 12 cans, he's intoxicated, he'll be drunk driving. Nobody ever got arrested for driving under the influence of a cigar. And yet, the professional Alcohol Beverage Commission investigators in this case, after the total investigation, they suspended the person's license for 1 day, put it in abeyance for 1 year. The clerk was not fired, didn't lose her job. And that is how professionals handle situations. We are human. We make mistakes. This is an indiscretion. It is defensible.
Okay. I think the hearing is now closed, and do we have a motion to close the hearing?
Oh, the hearing, yes. I don't think we, I mean,
I don't know.
Was there a motion from you, or was that just a comment?
it was a motion just to get some discussion going as to what
So
we're
the
gonna
hearing is
actually
now
do.
closed to the public as far as, comments. You have a motion on the floor that decrease it to 1 day, the suspension.
I can second that.
Okay, any discussion?
One thing, just to clarify, is that you can reduce it to a 1 day, but then suspend the other 2, so in the future, if there was another
Within a certain
violation,
amount of time.
those 2 within, I think, 36 months,
Continue without
Those-
binding for
those-
36 months.
yeah, those continued days would get stacked on again, so
Sure.
that's an option as well.
Right. Okay, I'll actually amend my motion to
Okay.
that effect.
Any discussion?
Second, the amended,
Okay.
amended motion.
Okay. And discussion? I mean, I'm kind of torn because we, just not to set precedent, I mean, we have 2 other people who violated that day and paid their fines and their suspensions. And all the things that you're presenting and all the things you're saying certainly have some merit if you wanted to question the whole tobacco law, the tobacco control law. That's for that avenue, but that's not what we're here for. We're here to question what we can do. You made an appeal, even, though it was delayed, we granted the hearing. I'm just concerned that, if we make any changes to the suspension, how does that set precedent to the other retailers who were fined and did the same thing and did not, went past their 7 days and did not request a hearing, but, then do we,
I think we're showing compassion for the medical circumstances that you mentioned. We're showing compassion for the fact that you've had a very clean record, you're a very law-abiding person with your business, and we respect that. If someone else wants to make those same cases, that they
Right.
had a medical issue to delay their appeal, if they had a clean record and they want to lower the 3 days to a 1 day, I would hear them out. I don't
Right.
know if that's.
So I just want to make sure, raise that, because
Right.
that was the whole,
Not
you
to be
know,
unfair to the
when,
others.
you know, thinking of, you know, to grant the hearing, even though it was late, that was the basis that I did it on, and I just want to make sure that, you know, it's not setting any precedent.
And there is a precedent of, there have been hearings in the past with this board where there were extenuating circumstances, and certain violations have been reduced in the past. This isn't the first time it's ever happened, so.
So the motion on the floor, which has been seconded, is the fact that we are looking at decreasing the suspension to 1 day, and if there's any other violations within a 36-month period, then those other 2 days would be tacked on to the suspension granted at that violation. So can we have a vote? Everyone in favor? Aye. So the fine has already been paid. You will have 1 day suspension. And again, you know, if you want to pursue any other path with the law itself, then, you know, that would be a different,
We just have to set the day.
the day of the
So, yeah.
suspension.
So we have the 7th, 14th, 21st, and 28th. We are already out doing permit suspension checks on the 7th and the 21st. So,
Do you have a preference, Mr. Kraskauskas?
7th is fine.
Okay, thank you.
Thank you.
Next on the agenda is health department updates.
So I'll start with the landfill erosion control project updates, with the weather being so cold and conditions where they are, we've been waiting until we get some better weather conditions. And we are also still working on where we're gonna get all the funding for that project.
Anything further from the insurance?
No further updates on that, that's definitely something I have to. Still planning on getting that moving as soon as possible. Next is the landfill environmental monitoring updates. So on last Thursday, I held a meeting with myself, Dane Arnold, Rob Olivia, and Justin Enright. So myself, DPW, and Conservation held a meeting, as well as Veolia. Joe Drosny from Veolia was there as well. So we held that meeting to kind of just discuss areas where we might have overlap and areas where we don't, and just to get more of a communication going on what plans each group has and what issues are outstanding, and if there are ways that we can look at those issues together. One of the things that came up is the project. I guess there was a project that got started in Warren as far as repairing the leachate pumps themselves.
Okay.
So currently at the landfill, there are 6 pumps. Currently only 2 of the 6 are working. So
There's
that-
6 pumps?
There's 3 chambers with 2 pumps in each chamber.
Okay.
So they're in like separated
Okay.
chambers. So there's basically 2 stations that are operational. And so we just need to find out more about how much leachate is inside there, if it's getting pumped out enough, and what we can do as far as getting all the other pumps up and running.
So those are the ones that when we took the tour, there was a section of the ones where the fence kind of had gotten Are those the pumps that you're talking about?
There are actually, there's 3 different zones
Right.
of landfill. So there are, the one we just repaired and we had a bunch of dirt sucked out of the pump chamber was over by the gas flare. You can see there's these big, I think 1.5 to 2-foot pipes coming out of the ground. And that's the pump is down there in a pumping chamber.
So right now, then there's one pump that's not working, or two, with two chambers?
So there's a pump and then there's a backup pump
Okay.
in each chamber. So we just want to get working on that, and it could relate to the 1,4-dioxane management, the groundwater issues. So that is something else that I'm gonna get figuring out as far as if there were contracts signed for this, if there was money encumbered for this. I have to do some research and find out, because I think it kind of got dropped off in between Lauren leaving and myself starting. So we will continue to meet on an as-needed basis, and whenever you request something like that, kind of look at things going forward. I talked to CEC. I'm going to have one of their representatives attend the next Board of Health meeting. I avoided this meeting just because of the hearing today. So as soon as we schedule the next meeting, I will get CEC to come out to that. And if you have any questions or anything that you want to ask them or have them address at the meeting,
Okay,
just send that to me and I'll get that all put together.
okay.
Is there a specific person, or you can ask for someone?
It's going to be Phil Jagoba is my main contact there, so it should be him, or if he thinks there's someone who can speak to the questions better, he'll bring them along, so.
Experience.
Yes, so Phil actually worked for President Caldwell, who were doing the testing for CDC, so he's got quite a long history with the landfill.
And extend that to the public. If you have questions,
Yep.
send them over to Micah so that we have a list and maybe we can get them to him ahead of time so
Yeah,
we
definitely.
can
Yeah,
do.
yeah.
One of the things I'm just going to say is why it's been hard to track down some of the records are not digitalized. We've been talking about trying to come up with plans to try to get a scanner and maybe look at getting some of the volunteer help that comes through the city hall to help digitalize our records. So it's, because it's been, whenever anybody requests a record, it's been painstaking trying to find those records. So the delays are not for, that's why there's been delays in trying to come up with things. So hopefully we get somewhere with that soon.
Madam Chairman,
Yes.
may I just say a couple of things?
Yes, please state your name.
Thank you. Alan Russo, 211 Basement Road. I'm also a property abutter of the landfill property. 2 questions. The meeting last Thursday, interdepartmental, my understanding was that was going to be done at the next Board of Health meeting when everybody was available for the last meeting.
No.
I understood it as just an interdepartmental
Interdepartmental,
meeting.
yeah.
I'll have to go back and relook at my notes. I'm pretty sure, because I asked the question about the meeting, that it was going to be
Right.
public. And a follow-up question on that is there any public record of that meeting? Minutes or recordings so that the public can at least view the interdepartmental meeting discussion? Because that was really important.
Right, right.
Very.
My understanding was always that it was going to be interdepartmental to try to get the boards, conservation, DPW, and Board of Health, because as you know, you've been through this process here that, for quite months, and trying to get everybody on the same page and talking about this whole thing, because it's not just one board that has jurisdiction, it's all affected. So that was, I don't know what records are kept with interdepartmental meetings, but it was my understanding always that that was our first step. We wanted to get all the departments speaking and communicating. And getting CEC to come to our meeting and speak to us. Beyond, that as first step, just getting them to all sit down and discuss the matter. Because, and I don't know, I know the sludge informational meeting is coming up, if that will bring, the sludge landfill extension is not something we have jurisdiction on over the sludge landfill, but I'm hoping that,
My second
there will be
question
some
is,
information.
thank you.
coming back on that.
My understanding is it's important to have an department meeting. I supported that wholeheartedly. I just thought it was going to be public. But my second question is, what's the mayor doing about this? The mayor's your boss, right? This is an urgent contamination issue from the landfill property. We don't know the exact source, extent of the contamination, and we're certainly, as Dr. Parker mentioned at the last meeting, what's the remediation, what's the action plan? That's what we need to get to, but we need to...
And that's the process, I think that we've all been working towards, and that was the start of, he gets it, I'm not
This,
just,
one important thing is that this chemical there's no requirements for any kind of remediation or
Right.
anything like that. It's just, has a requirement to be reported. So there's really, at this point, we're gonna do what we can to make sure the landfill is operating as intended. But there's really not a plan beyond that as far as like if there's remediation, if we're told to do so, we will. But it's, 1,4-dioxane is just a reportable contaminant at this point.
it's not been determined, it's not like, it took a process before PFAS.
It's kind of the same
We
as
really are
PFAS.
being very, trying to be progressive about and aggressive with trying to address it since the beginning when we had the knowledge of it, that, last.
See, my question was really, what's the mayor doing? What's the answer to that question? We're not doing, we gotta stop the leak, wherever it's coming from, fast.
Yeah.
Well,
Because we don't even know where it is, so.
we don't know, we still don't know how long it's been there, and, there's so many other, is there anything coming from the sludge? And when I think back about the tour that we had, of where it was, the wetlands and everything, and then your property that abuts, we don't know. There's nothing that shows if it's not been there for a while, because we don't test it. We don't test any of those areas.
Right.
So, we're working towards trying to look at all of that. I think the
My question was just, I don't mean to belabor it, I know it's not a public hearing, I thank you for allowing me to speak. But my concern is, I think it's an urgent issue, all right? I don't care about the state regulations, I want to know what the mayor's doing about it. What's the mayor doing about it? And we talked about hiring an LSP, all right? I think that was discussed at the last meeting, licensed site professional to investigate the source and extent of the contamination. We got to do that first. We got to stop. We got to find out where it is and stop what's happening. And you're absolutely right, Madam Chairperson. We don't know if it's the sludge landfill or the solid waste landfill. There's a shared jurisdiction from the DPW versus respectively the Board of Health or Health Department. So, but to me, the first thing, and I think we clearly talked about it at the last meeting, thanks to Dr. Parker, was we're going to know more about how to get to the point where we can stop this thing from happening. That's what I'm concerned. We don't have a plan yet, and I don't hear any kind of a war room being formed yet. We had a review meeting. It wasn't even videoed and documented. We're open to the public, so I got a lot of concerns, and I know all of them aren't the Board of Health. But I'm here now, and I would ask other questions at other meetings consistent with that. So that's all I.
So was an LSP discussed to your knowledge as far as?
I brought it up last time, I actually had it on my notes here. So there are grants from Mass DEP.
it's looking at funding.
So it's called the Mass technical assistance grants, and currently we're just waiting for the opening period to start applying for that.
When does that
Into,
open up to?
doesn't say, it just says coming soon on the website, so.
What is it called?
It's called a technical assistance grant through Mass DEP, and that is for, one of the things we'll have to look into is because it's for, I think it's mainly meant for cases of extreme contamination where there's an actual chemical that you know is a concern to health, rather than something like what we're looking at, where it's something in the parts per billion and it's really undetermined what kind of hazards it poses yet. So there is some question about eligibility. Would we be eligible? But I'm going to be getting a hold of DEP
Well, I can
figure
help
that out.
if you need help writing that. I did a little bit of research on this, and I think the challenge is, you know, this is so new. It's so, the threshold was changed, you know, a bunch of things are kind of in flux. Also, what Sue was saying, these sort of forever chemicals are scary because they could have been here a long time and not been detected, you know, and then if they're there, is there a way to remediate them, or do they just stay at that level and we hope it doesn't go up, you know, because obviously if it's increasing, that's much more of a concern. It's
Well, and
concerning
if
enough
there's
that it's
an
there.
identified source, you
But we
know.
would need a grant to do some serial testing, to do some different locations.
I mean,
of
funding
testing.
is, you know, to get all these things done, we need funding, which is unfortunately one of the situations. Yes,
Yeah, I'd just like to make a real quick statement.
please state your name and address.
Paul the Mayo, I'm a citizen. The city of Gardner right now has $11 million of available funds. $8 million left over from the elementary school and $3 million in free cash. The money is there. I think we need to press the mayor to provide the funding. Never mind the grant, we've got the money, and as Mr. Russo said, time is of the essence here. His property is being polluted.
Do we have
Yes.
an idea on the cost that we're talking about, Micah?
I don't.
No.
Not at this time.
You know, his family, his grandchildren are all being threatened by a carcinogen. You know, we've been talking
Potential
about.
carcinogen.
Right.
So I think you're making a lot of assumptions.
You want,
I understand that you were all
I don't
very
think-
close to this.
I don't think you would put that
I
in
think
writing.
you're overstating the urgency here quite a bit.
No, I don't think so at all.
I disagree with you.
All right, that's part of public record, no.
It sure is, yes.
Well, I appreciate that information, knowledge that
But
there may be some potential.
the money is there. Let's find out because,
That's another
because,
Right.
assumption you're making
Yeah.
based on numbers from a budget sheet, so I think there's a lot more to it than that.
it's public record, it's
And
been made known.
We don't know
It sure is.
where
yes.
that money is, if it's, you know, identified. But certainly when, you know, we meet with the mayor or Micah meets with the mayor again, then it will come up.
Well, I think as a
And-
board, certainly we should, you know, suggest that
Yeah,
every possibility be looked into to pursue that avenue. I mean, we're obviously as a board concerned about
right,
this.
right. And, yeah, we've been communicating. We can do that as a formal to communicate that to the mayor formally. Informally, we have been. Okay?
Dave Antaya, 44 Stone Street, Gardner. I just want to make mention where you said the groups were trying to get together. It's interesting that the public hearing for this, for the plan, for the landfill extension is the same night as the Conservation Commission is meeting. And it would be pretty significant for them to be or have the opportunity, the members.
That'd be something for
Yeah, I don't-
DPW.
I know, I'm just saying, because you were mentioning
Yeah, I
where
don't
they're
know.
trying
I
to
mean,
get together.
I wasn't, I mean, it
I'm
was
just-
a, yeah.
I'm just trying to say that the communication
Yeah, I
has to
wasn't
be.
aware of that, but, I mean, the interdepartmental meeting, I don't know if those are open. I don't really know, to be honest with you, how those run, because it was interdepartmental. But like I said, from our last meeting, that was what we had requested to get everybody on the same page, and I think that was an important step to get done. And it was, I mean, as far as the, like I said, I never had the understanding that it would be public or here, you know, during our Board of Health meeting. But certainly that was a step in getting the CEC, and, you know, we can look again at getting an LSP, and, you know, we can formally inform the mayor that, you know, we would like to, you know, have that looked at as, you know, solid priority, and express that concern.
Thank you.
You're welcome. Okay,
So,
reestablishments.
just one last
Okay.
thing on environmental monitoring is that we will be having soil X come out to take a look at the damaged ground monitor watering wells. And they'll be getting a quote to replace those or repair those.
Oh, good. The prediction, according to the newspaper anyway, for the next 3 months, is it's gonna be warmer after this cold spell coming in, so maybe we can get some of this stuff done sooner than we
Yeah,
until it
absolutely.
thaws.
Food establishments, Chipotle is now open in Timpani Plaza. We have Tato's Fonda is moving into the former Crown Fried Chicken at 66 through 72 Main Street. They're just waiting on a final inspection from Building and Fire. Zawa reopened in their new location last week at 242 West Broadway.
Is their old location then closed?
I believe so.
They moved
I heard
everything?
they were gonna do takeout at the old place and have the new place for dining in.
Oh, okay, Angela's saying yes, yeah.
My
So-
son reads the Gardner News and relates all these important things to me.
So they are gonna keep both,
Both
facilities,
locations,
both
but one is
locations.
takeout and one is
Interesting.
dining in.
We had no freeborn illness complaints. We did have one emergency response due to frozen pipes, but a business had closed voluntarily already, so just gotta monitor that until we got the plumbing fixed. Housing inspections, property standards, we did do one condemnation on an two-family dwelling that was not occupied, the owner was out of the country, there was a pipe that burst, and the electricity had to be shut off. But they are now back, working on getting electricity restored, and then we'll come in and clear everything else once that gets sorted. The AGO's office is still moving forward on some receivership properties for town. Angela and I will probably be meeting with the new city solicitor at some point soon to discuss blighted, abandoned properties and what we can do there to get a little bit more movement on some of these. And tomorrow there will be a periodic, I think it's tomorrow, a periodic inspection at the Super 8. So that was just another update. Angela will be jumping in on
Okay.
that, so we can kind of.
yeah, I'm anxious to, so we only have a few families left there, or no?
No, the shelter is near its capacity.
It is, okay.
Yes, according to my most recent meeting with the HEAL Collaborative, they are still cycling families too. They have a 5-year lease, so this is not expected to be winding down with the current
Right.
situation. It's very much in flux right now, but right now they're close to capacity. This is just a periodic inspection for safety for the building with building, fire, and health are going to go in just to make sure that you know, the structure is sound, that the fire smoke detectors are working, that the emergency egresses aren't blocked. I'm gonna take a check on the sanitation, check for any pests, or also we need to check the kitchen there, because there's been some confusion about what's being done there in the kitchen.
Right, I was just gonna ask, are they still preparing meals off-site and delivering?
That is what is agreed on, yes.
Okay, so yeah. And do we have, or is that being through MPHN, like looking at the well, I guess through the schools, any of the children in the schools, and what about the adults for up-to-date immunizations and things?
There is a mobile clinic that comes in and does the vaccinations. They review all of their records and they make sure that they're up to date, or they put them on a schedule to become up to date.
Right, okay, and that's still ongoing?
That's ongoing.
All right, I don't have a lot for prevention other than just planning for the upcoming health and wellness fairs. We have the Greater Gardner Health and Wellness Fair scheduled for April 24th from 5 to 7. And then the Gardner schools, I think, will be the week prior to that.
And that's at City Hall, April?
Yes.
Yeah.
April 24th. I found out from the city auditor that we still have some grant funds for substance abuse prevention from a SAPC West grant. So Veronica's working on identifying some projects that we can use that money for.
Okay.
And the last thing I had was that on the agenda is that we just do not have an inclement weather policy for the transfer station. And it just came up recently with some of the extremely cold temperatures, whether or not we should implement something like that. So I can definitely write something up and present it to the board at the next meeting.
Yes, I would think that would be a great idea.
Extreme heat, extreme
Yeah.
colds.
And do we have any other information on trying to provide a better type of shelter area for them?
So
Bathroom?
there was another grant that I think we had forwarded some information to the grant writers that the
Mhm.
mayor had brought in.
Yeah,
And we were gonna kind of tie everything with improving the sewer, improving the sites, everything. They were gonna look for some money there. Otherwise, I got a quote for a modular building. It'd probably be in the neighborhood of around $300,000. But it could be much less because we can get all of that covered, like utility hookups and stuff like that will be covered.
would that include restroom facilities?
Restroom and heating and cooling system.
I mean, it's really just a little, I mean, in all this cold and stuff.
Yeah, so I've looked into options. It's just again a matter of getting money to get something out there.
Okay. I have a few, we don't have a thing for new business, but a couple things. So the MPHN, the Montezuma Public Health Network that we are a part of, those meetings we will, I think they're going to discuss, there's a meeting on Wednesday, and we'll going to discuss about posting those so that anybody from the public, from the different communities should, are aware of them too. Right now, we're still, the state does a lot with, is promoting the shared services, or the NPHN is actually a public health excellence grant. We're all, the state, trying to keep on regional programs, and so I just, there may be some things coming through that would be nice for everybody to be aware of. So we're gonna talk about that, I think, on Wednesday, about getting that posted out for everybody. The other thing is that we should elect a new chair, or elect a chair every year. That was part of the regs that we have we've been doing, so we need to elect a chair for the coming year.
So can I just make a motion that you continue as chair?
Yes, are you willing to
Yes.
continue, because you're doing a great job.
And I mean, and, you know, some days I question and wonder and want to go, you know, run away. But if you feel, you know, that I'm doing a good job and you want to, I mean, I do have more availability. It's a little bit more flexible, which is helpful too. And I try to stay active with as many of the public health communications and calls and conferences. There are so many as I can, but, you know. So I guess make a motion if you want to. You made a motion?
Yes.
Okay, all in favor?
Aye.
Aye. Okay, so, aye again. And the other, I'm trying to think what I was gonna, the Warman Center, well, the Warman Center is open for, we are, you know, the whole homelessness and especially in the cold is really something that just, I think probably bothers all of us, you know, looking at what can and cannot be done. I know that there's a list of resources. We don't have a homeless shelter through the city. But there are many resources that, through Alyssa's place, I've been sharing on social media. When it gets below a certain temperature, is it 32? Or I can't remember exactly what it is, but the Warman Centers open up at the community center, the police station, the library, I'm trying to think,
The
the
senior
center. So it's just, it's not out of our mind. We're looking at different things to try to address. It's just.
Do landlords have to maintain a minimum temperature? I know it's
Yes.
challenging when
Yes.
it's really, really cold like that, but I've had a couple of patients asking me, like, what can they have space heaters, but then they're having to pay the electric bill.
Tell them to call us.
Oh, yeah, we
Yes.
this is what we've been dealing with in the last 6 weeks. Yeah,
So
they
they're
call us.
not putting the heat on and they're forcing
Like
people to
60
use.
degree, this is someone with Raynaud's, so their fingers get, you know,
Yes,
necrotic.
it's
I mean,
cold.
they're not that bad yet, but they're like, if I don't use my space heaters, I'm going to have symptoms. And so it's not a nothing, it's not just like a
No,
chilly, it's
no.
a health thing. And I'm like, I think there's probably a requirement for them to meet.
Yes.
Yep, 64 overnight, 68 during the day, and that has to be the primary heating system. It can't be with supplemental heating systems.
Which a space heater would be
Is supplemental.
considered supplemental.
Okay,
Okay.
okay, good to know.
Yeah. Okay, so setting the next meeting. That would be February, February 24th is probably,
Yeah, good for me. I'll let you just.
Yep.
I will set the 24th. There's a possibility I may be out of commission for a few weeks, but if I am, then I'll let you know. But I'm gonna we'll put down the 24th.
So that's the meeting when the representative is going to be here.
Yes.
So you'll want to probably be here for that.
Yes.
Would we reschedule if you're going to have an issue, you think, or?
Having some surgery on the 13th, I'm thinking I should be able to be here. Hopefully, yeah, I should be able to be here. I
Now
should.
we can reschedule.
Yeah, or I might need a ride. Yeah, okay. All right, so take a motion to adjourn.
Make a motion to adjourn.
I'll second it.
All in favor?
All right.
Motion is adjourned at 5:55 PM.